the questions that comes up for me with all of this is, why is there such a stigma about this in our society? And I just saw this in the news yesterday. Um, the Pope recently passed, and there was a lot of commenting online that I saw about people being bothered by seeing the body. And then there were people who were bothered that people were bothered by seeing the body and not understanding why people were bothered by that. And I think part of the discussion is that death and dying in American society is highly stigmatized. And I know that a lot of the reason for that is because people are just uncomfortable with death. And then when you have a cultural ideology that stigmatizes it, it doesn't help. And I think there's a few moving parts to that. Part of the reason death is stigmatized in our society is because we as a society worship youth, and we shun old age. You can see how many, people rip on old people online. I mean, it happens to me all the time. You're a granny, you're old. Like people who are old are marginalized. The idea of getting wrinkles, we don't have billion-dollar industries for nothing. It's because people want to continue to look young. And I'm not knocking anyone who wants to have surgery. I'm just saying there are cultures who embrace old age and value it, and ours is not one of them. So that's part of the reason people avoid aging. They avoid death and dying. They want to avoid topics like that because in our society, it has been made uncomfortable for people, so they avoid it. The other issue I will talk about is the ethical issues surrounding it. And a big piece of it in America is that a lot of people are opposed to medical aid in dying and assisted dying because of their religious ideology or belief. They're opposed to it for that reason. And I think there's a lot of ethical issue too. For example, in Canada right now, they're attempting to add non-terminal diseases to medical aid in dying, including mental health issues. And there's court battles being fought right now. The ethical issues that come up for that include, are people being offered enough alternative treatment before they're being offered, medical aid in dying as a solution to a problem that's not terminal. I mean, I do think that's a worthy discussion. Like that's a whole nother issue than talking about people who are choosing medical aid in dying who are already terminal. If someone's already terminal, I think that's ethically different than someone who has a disease that's not terminal. And I think it needs to be carefully discussed. But those are a few of the things that come up. The discomfort in America, the avoidance, the worship of youth. And I think, it is important to move past some of those issues, to dig a little bit deeper past just discomfort, because I personally feel like we treat animals more humanely than we treat humans in end of life. When animals are suffering and it's clear that they're not going to, make it, they're euthanized. And I think that, having medical aid in dying for people who are terminal is not a lot different than that. It's a grace and a kindness to not have to endure that suffering for some people. And I don't think that decision should be made for any person by another person. That person should be able to make that decision for themselves, how they want to end their life if they're already terminal, whether or not they want to go through that last, part that may be extremely painful and traumatic, or, if they want to choose a different alternative. So I think those things are really important to think about. The ethical issues, I could make a whole nother video on that, but I just wanted to kind of bring up some of the things that are currently happening. And I think as more states continue to look into this, it's going to be something you hear more about. Some states have already legalized it. It's obviously going to become more of an issue that's going to be, continuing proposed legislation. So it's a good idea to think about it and to figure out how you feel about it, not just because these are things we may end up voting on, but also because it would be a good idea to know how you think and feel about these things for your own life. And I hope this information was helpful. Thank you.